Today we're grateful to be providing 1,000 vaccines to the residents of suburban Cook County here at the center. This week, Cook County marked two important milestones in our COVID-19 vaccine program. Last Monday, all residents aged 16 and over became eligible for the vaccine. On Thursday, Cook County administered its 500,000th dose. That is 500,000 doses have been delivered into arms in Cook County. Cook County's COVID-19 vaccination program has prioritized equity every step of the way. Now that more categories of residents are eligible, that is everyone over 16, we will continue to focus on distributing our supply equitably and ensuring that it goes to residents who have the greatest need. Equity also means meeting people where they are. That's why we're here, to provide vaccine directly to residents in the community at a location that's convenient to them. In addition to the point of distribution sites, we have 6 large-scale vaccination sites throughout Cook County, including one at Triton College, also in Morton Grove. There's also a site in Des Plaines, conveniently located for residents of the northwest suburbs. As many of you have heard, this week the CDC and the FDA recommended pausing the use of the Johnson & Johnson vaccine after reported cases of blood clots. Now, let me just point out, we've delivered more than 6.8 million doses of the J&J vaccine, 6.8 million, almost 7 million, and what we're looking at are 6 cases of an adverse reaction relating to blood clots. So 6 people out of almost 7 million had an adverse reaction. Out of an abundance of caution, the CDC has asked us to stop using J&J, and we have. We're using only Moderna and Pfizer vaccines. I'm proud of the progress in vaccinating our residents and protecting our communities. Finally, after such a long and difficult time period, we can see a light at the end of the tunnel. Now, I'd like to turn the microphone over to my favorite congressperson, Jan Schakowsky.
I am so grateful to President Tony Preckwinkle, who has been such an incredible leader. This is their site. It's a distribution site. It is only for today, but it's 1,000 people who are going to be able to get the vaccine. And then the follow-up vaccine will also be delivered here as well, will be brought here when people are eligible. I want to thank the mayor, who is always so concerned about his constituents and making sure that they have what they need. And of course, to the Muslim Community Center, I'm so proud of the work that you do, the education that you deliver, and the community services that you do. So we are moving ahead despite the J&J situation with getting as many vaccines as we can. And now it's pretty much open to anyone who is over 16 years old. And we encourage everyone that can to sign up and to get the vaccine. We don't want any hesitancy here because we are starting to climb up in the number of people around the country that have been vaccinated. And the result of that will be that we'll have what they call herd immunity at some point, and the virus won't be able to survive. I wanted to tell you one thing that I'm really focusing on, and that has been about equity, including internationally. Because the truth of the matter is that anywhere that the virus exists, everyone is in danger around the world. Humanity, our health, is at stake everywhere. So far, I've been trying to urge the United States to take a leadership role in making sure that we don't have vaccine apartheid when it comes to other countries, and that we can deliver the vaccine and create a situation where some countries can manufacture their own to drop temporarily the idea of intellectual property rights of big pharma and allow countries to have access to vaccines. We want to do that at home too, make sure that all communities have the vaccine available to them, and I'm just so proud to be here with these leaders today. Thank you very much.
Thank you. Thank you, Congresswoman. Next, we're in Morton Grove, and it's only appropriate that our mayor, Dan DeMaria, has a few words to say. Mayor.
Thank you, Madam President, and I hope I'm your favorite mayor in Cook County. Congresswoman Chakowski, thank you as well. My comments today are going to be pretty brief, but I think what today represents is something that I've been advocating for the last 3 or 4 months, and that is to get it to a more local level, especially for the senior population. It's not easy for seniors to get in a car and drive 40 miles away from here to get the vaccine and then go back 2 or 3 weeks later to get the second vaccine. So today, I'm just so proud of our village staff, our county board, especially Commissioner Suffredin, as well as Illinois State Senator Ram Villavam, who also was key to getting this to the MEC. I want to thank the MEC, obviously, for hosting this, being a great community partner as always. But again, the important thing for me today, and I think for everybody to note, is that through the federal government, down to the state level, down to the county level, down to the municipal level, you have governments working together to make it easier and more efficient for not only seniors, but for all of us to get the vaccine. I am very confident that in the next few months we'll be somewhat back to a normal lifestyle, and I think that's a testimony to all of the people that are working behind the scenes, the doctors, the government as well, and just people every day volunteering to get this done. So I want to welcome everybody to Morton Grove. Thank you all for doing this in Morton Grove, for my residents, for my senior population, and we're going to be better off because of a day like today. So there's 1,000 more vaccines in the system today. It's good stuff. Thank you very much.
Thank you, Mayor. All right, next I'd ask Israel Rocha, who's joined us, CEO of Cook County Health, to say a few words. And of course I want to thank David Jones, who is our sign language interpreter, and I neglected to acknowledge at the outset. Israel?
Good morning, everybody.
Good morning.
Good morning. I want to start by thanking President Preckwinkle and, of course, our Cook County Department of Health for helping to organize today's event. I'm thrilled to be here on the Muslim Community Center for this important vaccination event. It is one of our special events that is part of our campaign known as Vaccines on the Go, bringing vaccines to where we live and work, partnering with individuals who are trusted voices in the community that can help educate and bring down the barriers against vaccine hesitancy. That is the most important part of what we can do. We all know that we have large centers. We have many different ways that individuals can get vaccinated. But everybody, as we are a diverse group of people, of concerns, of thoughts, of cultural background and understanding and just information, we all want to be able to get our vaccines in diverse ways as well. And so today is an approach to be able to bring vaccines to the local community, to use trusted voices, and to be able to be where people live and where they work, and be able to make sure that everybody gets a chance to be vaccinated, which is the most important part of what we're here to do today. This week we reached a very special milestone. Cook County Health administered its 500,000th vaccine dose. Together with the wonderful work that our Cook County Department of Health is doing and has been able to coordinate the delivery of 850,000 vaccines provided to residents in the Cook County Department of Health suburban jurisdiction, we've also been able to bring those doses to 400,000 people. We know it truly takes the community as a whole to reach these goals, and exciting partnerships like today help further that endeavor. Community pillars such as the Muslim Community Center play a critical role for the constituents that you serve every day. You have credibility in your community, you are committed to your community, and your constant presence in the community makes sure that you're a trusted voice and people understand what you're bringing the information for their concern. This community center is a vital part of helping communities and individuals come together to get vaccinated, to live healthy lives, and to be safe. We look forward to working with all different communities, all different organizations throughout Cook County to continue to expand our Vaccines on the Go program, to make sure that everybody has a chance to be vaccinated and that everyone gets the education, the information, and the assistance they need to make the decision to be vaccinated. Thank you all so much, and it is really, truly just exciting to be here because it's with the help of community groups like the Muslim Community Center that is helping us to reach residents from every corner of the county and ensure that together we can reach that beautiful milestone of a herd immunity where over 80% of our county's residents can be vaccinated. I'm now very pleased to introduce Dr. Kiran Joshi, the co-lead of the Cook County Department of Public Health. Thank you.
Thank you, Mr. Rocha, Madam President, Mr. Mayor, and of course, Congresswoman Chakowski and you all at the Muslim Community Center. I think this is, again, just a wonderful example of a great collaboration between our community in suburban Cook County and governments at the municipal, local, and all levels, really. Earlier this month, we opened up to phase 2, and as was stated earlier, all residents who are 16 years of age or older are eligible to be vaccinated. This is particularly important because we're at a critical time in this pandemic. COVID-19 cases have continued to increase over the last month, and we're very concerned about a potential for another surge. There is some hope in that we've seen cases level off over the last week, but I do want to point out that this rise in cases has been fueled by individuals who are in their 20s, 30s, and 40s. So we urge young people in particular to go out and get vaccinated. Continue to wear your mask, to wash your hands, to keep your distance, and to be careful with crowds. It's these tried and true public health measures that helped us bring the winter surge and the spring surge last year under control. And I would argue we could do the same again this year if we all pull together. Events such as the event today, at which we'll vaccinate 1,000 individuals, are really important in the race that we're running right now against these rising case rates. We've expanded our community vaccination program in several important ways to win this race. We've expanded our mobile operations through partners such as Jewel Osco, which will be administering vaccines today. They're working to bring shots to community groups, to homebound populations, and to people who are facing challenges with mobility. We're also standing up vaccine sites specifically in the 32 most vulnerable communities in suburban Cook County to make a measurable difference on equity. This vaccine equity is our ultimate goal. I think it's the right thing to do, as Congresswoman Schakowsky mentioned. It's the right thing to do for humanity, but it's also the right thing to do for good public health. Anytime anybody is vulnerable to COVID-19, we're all vulnerable as a society. The Muslim Community Center knows that better than anyone, and I salute their leadership. And I'm so happy to join them today. Thank you once again for all the amazing work that you're doing and for being advocates and champions for public health. Thank you.
Thank you. Can I have my cheat sheet back? Thank you. All right, next, Ishaq Lot and Omar Khan, who are co-chairs of the Muslim Community Center Health and Awareness Committee.
Good morning, everyone. Thank you for coming.
Introduce yourself.
Yep. My name is Ishaq Lot, and this is?
And I'm Omar Khan.
We're both co-chairs of the Muslim Community Center Health and Awareness Committee. We welcome everyone here today to the Muslim Community Center. We are proud to host this event in conjunction with the Cook County Department of Public Health. We're thankful to our partners in public health, Dr. Joshi, Mr. Rocha, Dr. Korpix, and Dr. Nimi Nemawakal, who helped facilitate today's event. And we're also thankful to Congresswoman Jan Schakowsky and Cook County President, Ms. Preckwinkle. We thank everyone. This pandemic has disproportionately affected communities of color and minorities with the worst outcomes, reflecting the deep inequities within the healthcare system and within our society. We thank the President for partnering with us in the faith-based community to offer and address these inequities and delivering life-saving vaccines to our community, both within the Muslim Community Center but also to the surrounding neighborhoods here in Morton Grove, Niles, Skokie, Lincolnwood. COVID has a mortality rate in the United States of 1.8%. All of the available vaccines are 100% effective at preventing death. That means that for every 1,000 Americans that are vaccinated, 18 people will live. Today, we're fortunate to offer vaccines to 1,000 people here. So we're hoping that 18 people will live as a result of our efforts here today in conjunction with our partners in public health. Looking out for one another in the interest of public health is a tangible benefit to the diversity and inclusion of America and our overall society. This event is occurring during the holy month of Ramadan for many Muslims, which represents a devoted time of selflessness and service to others within the community. We believe in Islam that saving one life is as if saving all of humanity, and we thank everyone here for the support and leadership that we received within our MCC community from Mr. Qadri, our volunteers, Dr. Adam, Ms. Ahmed, notably President Kamran Hussein, Amal Mohsin, and Habib Qadri. Thank you, everyone, for coming, and hopefully we can have a successful event today.
Absolutely.
Thank you.
Thanks. And again, my name is Umar Khan. I just want to thank the community for trusting us in holding this event. Ishaq and I have been working on this, as well as a number of volunteers as well, Dr. Adam and Salman Chaudhry, a number of people that are kind of behind the scenes, people that are here last night till 1 a.m. setting up. But, you know, we've identified, I would say, a number of obstacles over time, whether it be cultural sensitivity issues, language barriers, trust, you know. And so being a community center for, again, the local neighborhoods, we appreciate that you guys have put in the trust in us to see this through. And similar to what Ishaq said, this is the holy month of Ramadan. So this is a time when we reflect, revitalize our faith, work with our community members, you know, throughout the year, of course. But it is very much about giving back as well and giving to our community members. So again, thank you all for trusting us and seeing this through. And we look to continue to work with our neighbors moving forward as well. Thank you.
Thank you. All right, Hannah.
We'll do reporters in the room first. MDC, do you want to start?
Well, my question, you know, I've seen various community centers be able to hold vaccination clinics. How does that happen on the county level?
Let's ask Dr. Joshi, who's co-lead of Department of Public Health, to respond.
Thanks so much. Any interested organizations can submit a request via our website. It's vaccine.cookcountyil.gov. There's a request form and there's a queue. We do prioritize requests both from the 32 communities that I mentioned earlier, as well as organizations that are serving vulnerable populations. Thank you.
WGN?
I wanted to ask a little bit about the challenges. Can you talk more about overcoming the challenges and concerns that people in this community that may have stopped them from getting vaccinated?
I think within the general age of social media, there's a fair amount of mistrust and amplification of misinformation. I think what's made us successful in our effort today is that we have relationships with people in the community that go back decades. And many people know us from everyday interactions. And so we're trusted faces where they can approach people for information about vaccines, about medicine, and about their health in general. Using those relationships, we're able to encourage people to look out for their own health and for the collective health of the public.
Anyone else in the room? You have a question?
Yeah. For the mayor, do we have any idea of how many residents of Morton Grove have gotten vaccines so far? And then I'd like to follow up.
As far as the actual number of vaccinated Morton Grove residents, I can't give you the exact data on that. Today, we had roughly 100 seniors register, and probably after we had some extra vaccines that we could put out there, I don't know how many other people are going to be showing up, but I know for the most important thing is that we have 100 seniors that are getting vaccinated today that, like I said, can stay in their town, not have the inconvenience of driving all over Illinois to get their shot. So that's what I'm most worried about. So that's pretty much the stats that I can tell you.
Any skittishness about the people getting the vaccine during Ramadan?
That's a good question. We actually had reached out to our community and let it be known that the permissibility of taking a vaccine is not a problem during the month of Ramadan. And again, because it's coming from a trusted community partner, we had a high level of trust and engagement within our community members.
Do you know how many, what percentage of Cook County suburban residents have been fully vaccinated now?
Dr. Joshi?
Thank you. I think that number of fully vaccinated residents is at about 20% when I last checked earlier this week. And I want to just lift that up as what I think is really a huge success story for public health and our healthcare systems overall. Because if you stop and consider that number, really it's 1 in 5 suburban Cook County residents that are now protected, fully protected against COVID-19. And what I would argue is a very short amount of time. Thank you.
Anyone else in the room?
I just wanted to ask about supply. I know we were having supply issues
I'll ask Israel to respond.
Hi, good afternoon. So what I would say about supply, of course, there is always a need for more supply. I'll make it very clear, I think, in conversations we've had with the president, her wish is that everybody would be able to get the vaccine in one day and we would be able to move forward. So until that happens, I think we're always going to be short of supply and argue for more. But what I can say is that it continues to increase. So every day and every week and every shipment, we get a little bit more and a little bit more and a little bit more. And you're seeing that more partners, more communities are having availability, and we're able to do now new innovative things to really have diversity in the way that we're distributing vaccine. The goals have always been to vaccinate as many people as possible, as equitably as possible, and as geographically diverse as possible, and those still remain. And the more supply that we have, the greater we can achieve that endeavor. But every day we're getting a little bit more, but not where we want to be, which is where we could have hopefully vaccinate everybody in a few days. And we're not quite there yet, but we're making progress.